Hello everyone, this is Lipi Gautam. Today I am going to discuss about COPD, that is chronic obstructive pulmonary disease. COPD is a name for a group of illness that include emphysema and often chronic bronchitis. COPD is a progressive chronic disease that makes it difficult to breathe. Chronic means that people with COPD will have COPD for the rest of their lives, and progressive means that symptoms will continue to get worse. A person with COPD has airways that don't allow as much air into the lungs as healthy airways and lungs do. The airways may also be inflamed, which causes cells that make mucus to grow more than normal. This can lead to chronic coughing to get rid of the extra mucus. Now, what is chronic bronchitis? Chronic bronchitis is the inflammation of the lining of the bronchial tubes, the airway you use to breathe. The inflammation makes it difficult for the air to flow to and from the lungs. This causes you to cough up thick mucus or phlegm. Over time, the irritation from the inflammation and coughing also causes the walls of the bronchial tubes to thicken and develop scars. If the walls become too thick or scarred, they can block airflow to and from your lungs. This causes shortness of breath, coughing and wheezing. Most people with chronic bronchitis have COPD. Now, the cigarette smoking is the most common cause of chronic bronchitis in women and men. Actually, women are twice as likely as men to be diagnosed with chronic bronchitis. Now, let's learn something about emphysema. Emphysema is a type of COPD. In emphysema, lungs tissue gets weak and the walls of the air sac, that is alveoli, break down. Normally, oxygen from the air goes into the blood through the air sac walls in the lungs. If you have emphysema, the damaged air sac walls means less oxygen can get into your blood. This causes shortness of breath. Now here also, cigarette smoking is the most common cause of emphysema. There are more than men living with emphysema than women, but that may be changing because women are now diagnosed with emphysema almost as often as men. Now the question arises, who gets COPD? COPD usually happens to the people who are 40 and older. More women than men have COPD. Women also develop COPD at a younger age, often between 45 and 64. Also, the number of men dying from COPD is going down, while the number of women dying from COPD continues to go up. Researchers are not exactly sure what's the cause of the increased number of women suffering from COPD. They also think it may be because the number of women who smoke is now almost as high as the number of men who smoke. Experts think that cigarette smoke may be more damaging to women's lungs. Women have smaller lungs and bronchial tubes than men, so the same amount of inhaled smoke may cause more damage. And the hormone estrogen also may make women's lungs more sensitive to tobacco smoke exposure. Now, how does COPD affect women's health? Women living with COPD often have other health problems such as asthma, osteoporosis, heart problems, and many other arterial problems. Asthma, this is something like COPD. Many women with COPD also have asthma. Osteoporosis, this condition is more common in women, but more than half of people with COPD have osteoporosis. Experts are not sure why this is. It may be related to steroid medicines that are sometimes used to treat COPD, but some studies show that COPD is a risk factor for osteoporosis even without medicine. Other problem is anxiety and depression. Anxiety and depression also affect many women with COPD. In one study, women with COPD had higher level of anxiety and depression compared with both men with COPD and women who did not have COPD. Other problems like heart diseases. Researchers think that COPD may cause inflammation throughout the body, including the blood vessels. This inflammation can make blood vessels stiff and increase the risk for plaque buildup. Over time, this can lead to heart diseases. Women with COPD may also have other health problems caused by smoking and second-hand smoke. These include lung cancer, high BP, and other heart diseases. Now, what are the symptoms of COPD? At first, COPD may cause no symptoms, or you may have mild symptoms that you think as some other illness. As COPD gets worse, symptoms usually become more serious. Common symptoms for COPD are an ongoing cough or coughing up lots of mucus or phlegm. This mucus is also called as smoker's cough. Shortness of breath, especially with moderate physical activity. Wheezing sound, that is a whistling sound when you breathe. And chest tightness. Studies show that COPD may be underdiagnosed in women. That may be because COPD was more common in men until recently. If you have symptoms of COPD, talk to your doctor about test for COPD. Now, let's see how COPD is diagnosed. To find out whether you have COPD or not, your doctor will ask you some questions about your symptoms, health, and family health history. He will ask you about your exposure now or in the past to the things that can cause COPD, such as tobacco smoke, air pollution, dust, or chemicals. He will do a physical examination, including using a stethoscope to listen for wheezing or other unusual chest sounds. He will do spirometry test, in which he will measure how much air you breathe out and how fast you do. Some other tests like a chest X-ray or chest computed tomography, that is CT scan. These tests create pictures of heart and lungs. The picture can show signs of COPD. Arterial blood gas test and pulse oximetry test measures the oxygen level in your blood. It can determine whether you need oxygen therapy or not. So, now we reach to the point where we will discuss about the treatment of COPD, and we will do that in the next video. Thank you.